name is Dr. Michael Corey. I'm a doctor of chiropractic. I've been practicing with your friends, neighbors, and loved ones here in Orange County since 1996. My practice is focused on neurological assessments, on metabolic assessments, and on structural assessments. No other office in Orange County is going to treat you neurologically, structurally, and metabolically. And I will guarantee that we will leave no stone unturned to help get you well. Now, I have thousands of hours in postgraduate education regarding peripheral neuropathy, functional neurology, metabolic disorders, and nutrition. So once again, you're in good hands. And what I wanted to do is talk to you briefly about, just to give you a summary, what peripheral neuropathy is. Periphery means away from the center. So we have a condition that's away from the center. Neuropathy is abnormal condition of the nerves. So abnormal condition of the nerves away from the center. Usually people with peripheral neuropathy will experience pain and symptoms, burning sensations and so forth in the feet and in the hands. And that's primarily where it usually will stay. Unless it progresses further, then it can affect your breathing, your reproductive system, and other organs as well. So without further ado, let's talk about some of the signs and symptoms of the common peripheral neuropathy patient. Number one is we have numbness. We have numbness in the hands or in the feet. All these symptoms can be in the hands or the feet. We can have burning sensation. We can have cramping. We have sharp electric pain. We can have pain when you're walking. We have difficulty with dexterity or fine motor movement. We can have difficulty sleeping because the legs are so uncomfortable you have to keep moving and jostling in bed. We can have prickling or tingling sensation. Some of my patients with peripheral neuropathy, they can't go barefoot any longer. They can't walk across an uneven surface. And if peripheral neuropathy progresses, then it can lead to balance disorders, which is the #1 cause of seniors falling and then later on passing away prematurely, because of the loss of proprioception or the inability for them to feel the ground and have a steady footing when they're walking or moving. So peripheral neuropathy is a condition that will affect multiple systems in the body, and it can be caused by multiple systems in the body. Thyroid dysfunction, hormone imbalance, liver dysfunction, neurotransmitters in the brain, immune system problems. Blood sugar is a huge, huge problem. Just like the diabetes and the obesity is rampant in epidemic proportions nowadays throughout the United States and throughout the world. We have to get a ground of this, and we need to make sure that we can go through and correct those underlying causes and back this system up. You know, we're in a system of emergency care or acute care, and we're treating chronic conditions with acute therapies. It just doesn't work. Look at the numbers. Peripheral neuropathy is, once again, it's not a problem that you don't have enough drugs in your body. It's not a problem that's going to just go away by taking a medication. What I want you to do and what I want you to understand is that the functional values of your blood chemistry is so important, and your doctors are not evaluating you from this perspective. Now, we have traditional lab values which are wide in range. When you get your numbers back from your lab after your doctor sends your blood in, we'll see these numbers out here which are wide, broad ranges. What we use is we use a functional or optimal level range. Makes sense? We want to get you from an unhealthy person to a healthy person, so we're going to use healthy lab ranges. We're not going to use those sick ranges that the medical community is using. Now, it makes a big difference, and let me show you why. Glucose, for example, if we're looking at traditional values, your doctor is looking at 65 to 110. Some lab values will be up or down depending on the area of where you're getting checked. Optimal functional ranges are 85 to 100. Now, if you have 73, then you're actually hypoglycemic. We're going to have destruction of brain tissue because that glucose is too low. If you're over 100, then you are insulin resistant, if it's 100 to 126. And if you're over 126, then you've probably been diagnosed with diabetes. Now, I hope that's not the case, and hopefully we're catching it early. But if that is the case, then we have to take you where you are, and we will help get you well. Thyroid is very, very important because they have a huge broad range of 0.3 to 5.7. And within that broad range, 0.3 to 5.7, functional ranges, we're going to bring that down into 1.8 to 3. So anything below 1.8 or anything above 3, that's abnormal. It's not a healthy individual's blood lab value. We want to make sure that we take you away from those big wide ranges of 0.3 to 5.7, bring you into 1.8 to 3, and it's going to make a huge difference with all of your blood chemistry. Now, what I want you to understand is that you cannot drug yourself or poison yourself back to good health. It just doesn't work. If you have a wilting plant at home, or if you're at home wilting away, you can't sit there and give yourself a poison and think it's going to correct and make you healthy. It does not happen. Now, I'm not going to take you off medications. That's up to your doctor. He's prescribed them or she's prescribed them, and that's between you and your doctor. I will give you the best advice. We will help get all of your labs within normal ranges, so they will be very, very happy to take you off those medications once you achieve those levels of success with our program. Now, we're going to be looking at brain hemisphericity. We've all been told, and we learned in high school or college, that the left side of the body is controlled from the right brain, right side of the body is controlled from the left brain. We want to make sure that those signals are going from your feet up to the brain and back down again to regulate how the nervous system is regulating your functions of muscle contraction, relaxation, venous return of blood, and arterial perfusion of blood down to the extremities to give you circulation. So we're going to look at your hormones, we're going to look at your midbrain, we're going to look at your cerebellum, make sure the firing in those areas of your brain is good. The parietal lobe is where you get sensation from. We want to check that. Blood sugar levels, oxygen levels, and your cortisol levels. We're going to leave no stone unturned to make sure we get you well. Now, what makes our program unique is that we're going to put all those pieces together just as a whole person should be. All at the same time, we're going to bring everything together. We're going to get your feet feeling normal again. We're going to get your blood chemistry straightened out so that we can correct the underlying causes of your dysfunction. Very, very important, and it's a different approach than what medicine is currently doing. It's just a medication. It's all great symptom relief, but from a chronic condition standpoint, it just is not working. And otherwise, if it was working, you wouldn't be watching this video right now. Our goal is to help you find the most effective natural protocols to enhance your body's function, get the symptoms to be resolved, make you a healthier person so you can live a healthy, long, and happy life. I want to get you on your feet, and I want to get you on your feet quickly, as soon as possible. Our program does take time, but it'll be much more soon if you take action than if you just let it progress and you're going to get worse and worse, and then you come in a later time. We have to catch up on all that further destruction that's occurred within your body and within your feet. So if you want to order a free DVD, please check the box on the web page that you're looking at. It says click here for a free DVD. If you would like a free consultation, call my office at 714-730-5833. I want you to get relief, I want you to get cured, and I want to get you corrected. We want to make sure that we correct those underlying causes of the problems and help get you back on your feet and get you healthy again. My name is Dr. Michael Corey. Thank you for watching this presentation, and click the button or call our office for further help. Thank you. Bye-bye.